More than 3 months after testing positive for COVID-19, Prime Minister Dr. Rowley received his first dose of the Sinopharm vaccine. In early April, Dr. Rowley tested positive for the virus and had to wait at least 6 months to be inoculated as per WHO's guidelines. But that 6-month stipulation was recently reduced to just 3 months for a recovered COVID-19 patient. And after being inoculated just after 10 a.m., Dr. Rowley urged the population to also get vaccinated since he says it's the only way to get back to normal.
As I speak to you now, a large supply of vaccines are landing in the country. So for the next few weeks, we are going to have as many vaccines as we require to vaccinate persons who should come forward. It's a volunteer program, but that does not mean that because it is voluntary, you would decide that nobody is pushing me, so I wouldn't go and get vaccinated.
The Prime Minister adds that there is evidence that unvaccinated countries still cannot cope with the effects of COVID-19 and that deaths are being reduced by populations which are vaccinated.
Populations that are vaccinated are protected insofar as people are responding better to any infection. It is reducing the need for hospitalization. It is reducing the strength of the illness on you, and it is virtually eliminating deaths.
Meanwhile, Chief Medical Officer Dr. Roshan Parashram says the 800,000 vaccines which arrived in Trinidad and Tobago today will be available as early as Wednesday.
As you know, the health centers run by the RHAs throughout the country will be taking care of the vulnerable people in the first instance, which are those over 60, those with NCDs regardless of age, and healthcare workers in particular. So you can come out at any of the health centers.
Dr. Parashram adds that the ministry will also intensify vaccination at the mass vaccination sites in an attempt to use up the 800,000 vaccines in the shortest possible time. Sunil Lalla, TTT News.